we're at the front line of our epidemic. So previously, we had our press conference in the first hospital of the Guangzhou Medical University, and the previous one, actually, our academician Zhong and also the president of the university shared with everyone about the responsibilities and jobs endeavors made by the school students and doctors in the medical university. And today, the first affiliated hospital actually owns the only national level respiratory laboratory, and it's a well-known institution and hospital in China. And it also shoulder the major responsibility in terms and also the story and the work carried out by the medic teams of the first affiliated hospital, also actually covered by media from home and abroad, that also showcase the spirit and perseverance of our medics. So we have the shoulder our responsibilities and also showcase our expertise to treat the critical ill patients, and also have worked with experts from multidiscipline. Along, we also have Professor Li Yimin, the party secretary of the first affiliated hospital of the Medical School University, and President Huang Jingkun, and President He Jianxing from Guangzhou Institute of Respiratory Health, and Vice Director Zhao Jingcun of National Clinical Research Center for Respiratory Disease. And also we have Mr. Ren Pixin and also our special guests as well as media friends. Welcome you all. So first, let's go to our first agenda. I would give the floor to Mr. Huang Jingkun to give everyone a brief introduction about the work made by the first affiliated hospital in terms of the patient treatment of COVID-19. Friends from the media, good afternoon. First of all, thank you all for your long-term support, kind to our work of the first affiliated hospital of Guangzhou Medical University. On behalf of all staff in our hospitals, welcome you all to the press conference today. So first, I'll give you a bigger picture about our hospital. 117 years ago, the bank of the Pearl River in the visit town of Guangzhou, a small-sized hospital was born there. With the establishment of the new China as well as the liberation of Guangzhou, the hospital gained its energetic and development and become a prosperity, and also people got to know this hospital. The relatively Yang Shiguang was the first president, and you can see that's also because of these presidents, we bring more the right army DNA to our hospital culture. With development of the education, we changed the name for several times, but our DNA and also the style and spirit of Guangzhou Hospital has never changed in people's mind. And we always bring the bigger picture in mind. It's a affiliated hospital, given its small size, It was a common hospital, but with the expertise enriched and development for many years, the hospital has developed and always striven for devotion, exploration, and selfless dedication. The practitioners in hospitals always follow the Nanshan style of the dedication, thorough research, exploration, and team play, and also follow the SARS spirit. It's feel no fear in face of danger, seek truth from facts, as well as make selfless dedication. So we talk about the anti-SARS spirit, and Academician Zhong said, please bring the critical patients to our hospital. This message always stay in our heart. That's also applied this time when we fight against the epidemic of COVID-19. We are also was the first dedicated hospital and also deliver our commitment that is always bring the worst case to our hospital. We will treat them. Amid the epidemic, our bravest people, the young generation born after 1980s, 1990s, and they knew that it's a lot of danger in front of them. And also our academic and the medics also have the rich experience in fighting Ebola. The people born after 1960s, 70s, they also work together, led by Academician Zhong. And also we have the A2 battlefield in Wuhan and Guangzhou. And also we help to fight the epidemic in the African country. We always shoulder the big responsibility. And from 2003 SARS, 2008, the disaster, the earthquake disease, earthquake release and relief, the swine flu, you always can find the presence of the first affiliated hospital of Guangdong Medical University, and we never let our people down. So in the fight against SARS, the team led by Academician Zhong always worked in the Frontline and also come up with the A3 early and 3 the reasonable practice. And this is also rolled out worldwide. They become the backstone of the whole forces. That is why this time we mentioned that the early identification, early initiation, early treatment, and early deployment. And we have gathered the best resources, best personnel to fight these people's war against COVID-19 around China and also in Guangzhou. And we also had this fight with well-prepared strategies. We have leveraged our big platform. Academician Zhong said that we should always seek the truth, and we knew where we should strengthen ourselves, where is the room to improve, and we never say no, and we never bow to the weakness. We should strengthen our weakness and make an improvement. That is also why you look at our history back to 1971. We established the chronic respiratory department, and on top of that, we established the respiratory disease research center, which was the earliest one in China, with 40 years of development exploration. Right now, it's grown up to a well-known world research center for respiratory disease, and also playing a pioneering role in treating patients with respiratory disease. And we have the national level research laboratory, the respiratory department, the clinical research department, as well as the respiratory disease center owned by the National Health Commission and the regional health conference platform. And you look at this is help to lay the solid foundation for us to fight disease in terms of respiratory track. Looking forward, we have every confidence that under the strong leadership of the Guangdong Party Committee as well as the governmental officials, right now we also focus on to establish the project that already started. Will be finish the whole construction work this year and will be put into service next year. That's a national level research center for respiratory disease, and also we would like to bring our hospital to the clinical treatment, the research center, technology breakthrough center, as well as the talent pool here. Make sure that we can bring everything together to treat our patients, that across the board of academy, the industry, research. So we would like to make more contribution to the whole country. And thank you everyone again for your great support and care to our work of the first affiliated hospital of Guangzhou Medical University. Thank you very much, President Wang Jingkun. We talk about the history actually can trace back to the 1903. We have a bigger picture in mind, and we will leverage our strengths on this great platform to make more contribution. We believe our hospital will bring more energy to our hospital, to our city, to our country. And next, I will give the floor to President He Jianxing from Guangzhou Institute of Respiratory Health to introduce the progress made in the research and science and technology part. Friends from the media, good afternoon. Just now, Mr. Huang introduced about our institute. Actually, we have the CCM, Department of CCM, Internal Medicine, Department of Surgery, and we also have the institution for the medicine research and development. Facing this COVID-19, this is a pandemic after the 1918, the Spanish flu. Actually, our work related to different sectors. We look at the pathogen first. So we look at the screening, the tracing source, and look at this transmission. The gentleman next to me, actually, he led a team and separate a string of live virus from feces and urine of a patient. So that also helps us to understand more about the transmission route of the virus. And that also helps us to guide our work on disease prevention and control. And second, we talk about why this virus actually transmitted so fast than others. And actually, this is also transmitted in a hidden way. That is also under our focus. On top of that, we talk about it's one of the coronavirus. But actually, different kind of coronavirus have different clinical manifestations. But we talk about this is a new coronavirus. Therefore, led by the National Health Commission, we collected at the very beginning around 1,000 cases. So we summarized and made a deep analysis of all these 1,000 cases. And we look at the median number of incubation period. We talk about actually the symptoms not always like fever. So they just develop to a certain stage, and you found that the manifestation is fever, and also look at the incubation time. What is the shortest day, what is the longest day, and we release the article, the paper, actually. You can find our paper on the NEGM, and that's also inspiring. We believe that also actually laid a solid foundation in terms of guiding the direction of disease prevention and control, and also understanding about this disease based on our article. And actually, it's a top 3 most read articles. And also, actually, Academy Shenzhen received many emails regarding a lot of questions in terms of the COVID-19, and actually this dissertation received a good feedback and also the reputation by NGEM. And we talk about actually COVID-19, how that related to tumor, we talk about how that related to COVID, and also talk about how that related to the ages, and what about the COVID-19 with the complication, and we also released a dissertation in the European Respiratory Journal. And we also had the editorial. And we believe that we also will help the Europeans who are now facing a severe situation to do a better job in disease prevention control. And we also talk about detection of antibody. That's also part of our work. So based on the arduous efforts, we finished the PCR detection. Of course, PCR should not be the only way for testing. Therefore, with the joint efforts made by our institute and the third parties, 2 antibodies have already approved by the national FDA and right now applying at clinical practice. One is a Hexin company. And we talk about that the PCR actually help us also have the antibody help us to understand whether that person will not have that the disease before, and also whether that person have enough immune. And we also want to have the IgM and IgG antibody detection. Right now, this has applied in the airport, the train station, for quick detection. Fourth, we have worked on screening the COVID-19 treatment method, and we work with third party, and it's 23 large size pharmaceutical manufacturers as well as the local manufacturers. We have made the intro screening. 14 out of 56 candidates actually had the antivirus inhibitors. We believe we should give credit to the capability of establishing the P3 or the BSL3 laboratories, and also we have the capabilities to make these screening, because everyone is so anxious, we so urgently to know that which is the most effective drug. I believe the laboratory can play a key role in this part. Another thing is for TCM. Like 莲花清瘟, the capsule actually is a TCM, but we actually made the RCT based on the Chinese medicine. Actually, this is a Western approach, but that's applied to the TCM. And 莲花清瘟 capsule actually also proved it have effective in the inhibitors. And Academician Wang and Zhou Qi actually also started the work in stem cell therapy and also have gained a good progress in this regard. Fifth, we talk about the artificial intelligence plus the platform modeling to fight COVID-19. Li Shiyuan and the CES, as well as working with the Shenyang automatic company, and we talk about we would like to a robot to make the throat swab. Actually, we'll talk about normally if you want to do that, the throat swab should stay so close to the patient that really actually have a higher risk of infection. So if you use a robot, then people actually safer in this case. And we also talk about how to really identify COVID-19 and the normal influenza. Right now, we can tell that the identification rate can reach at least 90%. So this is how AI can help us. And we talk about COVID-19. If it's mild case, just for quarantine, I'd like them to do self-healing. More important is we should identify the critical patients at an early date. We also made some research in this regard. Actually, AI can play its role. So AI plus clinical manifestation. We talk about patients in hospital. We put in all the input of that patient and identify whether this patient have that possibility to develop to a severe case. Actually, this is so helpful. And mild cases actually in other places around the country actually stay at home. Only the severe ones were admitted. And we also use AI. So we look at the epidemic model and also help us to do the forecast of development of epidemic. The whole calculation result actually in accordance with the facts. So we established the whole model by the end of January and start to verify from February. The dissertation also released on the journal and also help the other countries to identify and focus the development of epidemic. So the click amount to 440 million times. And we also have work on the vaccine side. That includes several parts, as mRNA, as adenovirus, as well as the Epidemic virus. And we also talk about, in order to do a good job in the nosocomial infectious management, actually also have developed a special diagnosis platform for doctors and nurses, as well as the hospital beds. And also we developed a technical guidance. And we also work with international players from Europe, United States, Singapore, Japan. We had a lot of exchanges happened. And every day, we have a lot of different discussions going on with the different partners around the world regarding how to treat the patients, and also discussions on the treatment protocols, treatment plans, the therapeutic plans. I believe
2017年的我们正式更名为广州呼吸健康医院。大家总是知道，总是。
Thank you very much. That's the president from the Guangdong Institute of Respiratory Health, and we talk about General Secretary said that we should always put people's health and safety at the top priority, and the Guangdong Institute of Respiratory Health always practice in this regard. And actually, according to Mr. He's introduction, and he also had this in his circle of friends, saying that they always focus on the advanced research in science and technology sector. Hope we can forge ahead. Now the floor is open for questions, and we are really obliged to have our friends from home and abroad to join today's press conference.
请获得提问机会的媒体，首先通报一下
All right, and please identify your media affiliation before raising questions.
中间第一排、第二排的这位女同胞。
谢谢主持人，我是中央广播电视台。
Thank you very much. With CMG CCTV. My question to Academician Zhong. From the day one to today, it's around 2 months. So for COVID-19, our understanding. So what is COVID-19? So what's our standing right now? And what is our focus going forward in terms of the research? Thank you. It's already been 2 months or already 3 months. Actually, it's not a long time, but for us, we face a total new, brand new virus. What we knew? First, it's really high communicability. So it's higher than MERS and SARS. Second, it's a high mortality rate compared to influenza, not compared to SARS or MERS. Right now, actually, the mortality rate is varied. Right now, we look at around the world, the number, just only have the number until today. And of course, that mortality rate is not a natural mortality rate. Actually, that's after the intervention by a medical service. And right now, we look at the transmission rate and still the respiratory tract. We talk about that transmission happened from one respiratory tract to another. Chloroquine, phosphate, all are good candidates, and we also would work with global partners to make a new trial in this regard. But so far, I have to say there is still no designated medicine. But we talk about that we should prevent mild to severe or critical cases. Right now, the critical case is less than 5%, but it's really difficult to treat the patient. That's why we talk about right now, so far, more than 3,100 patients actually were died. Right now, we look at the pathogen and also the feature of the disease. We need to think about a way out. So far, there's no effective ways. What we have learned? Disease prevention and control. I believe the China practice have approved this, and we take the stringent measures, the most stringent measures. So we look at this kind of a high transmissible. The disease actually is developed so fast in the. We'll talk about this RO, the R0. Of course, the research have different numbers. It's around R0 equal to 3, which means it's much higher than influenza. So we talk about once it happened, the outbreak actually will very soon develop to an epidemic or even a pandemic. So we should really target it, the epicenter, to really cut off the spread at its source. So we should take more proactive role, because at the very beginning, the hospitals actually at the very beginning is overwhelmed. We talk about Italy, actually, you look at the hospital, actually, the beds are fully occupied, the doctors, nurses work around the clock, no time to sleep, but still there are enormous patients waiting outside the hospitals. And we talk about interagency mechanism. This is also practiced and initiated by China. And this is also another very good practice. So we talk about for any kind of respiratory disease, we should conduct this measure at its upstream, where we talk about at its source. I believe this is actually a classic practice, but also proved the most effective one. Going forward, what we should do? We should not rely on herd immunity. This is a disease with high transmission, high mortality rate. We talk about 60–70% of people actually infected and cured, and we are fine. There is no disease. We talk about the coronavirus. Actually, there's no data to say that once you infected and cured, you will be safe for the whole life. We talk about the other disease like the smallpox. Then we have the documents in this regard saying that you will be sure you will be safe once you're cured. But influenza, we talk about novel coronavirus. You should not rely on the social immunity, and we should also rely on the international cooperation. So actually, we quite keen to know the situation developed worldwide. Right now, so far, there's more than 30,000 cases confirmed in Italy, and we have more than 19 countries actually right now facing this severe situation. So we should work together worldwide. Xinhua News Agency. My question also to Academician Zhong. Right now we look at actually this disease developed so fast in other countries. We also send the medics to other countries, and we also know we send a team to support Iraq from Guangzhou, first affiliated hospital. So would you please talk about the medics in different countries, how to better protect themselves while treating patients? We talk about self-protection of medics. It reminds me that every time the crew, the attendant, saying that in case we encountered the dangerous, and you should first put the oxygen mask first to protect yourself and then help others, right? This is the same logic applied to medics. First, you should protect yourself, and then you can treat others. So at the very beginning in Wuhan, because of the shallow knowledge of this new disease and low awareness of protection, as well as shortage of protective suits, goggles, and other supplies, had triggered a large number of medics infected. So we, based on the calculation, I believe there were more than 3,000 medics infected. This was a really high number. That is also why we had quite passive at the very beginning, because we talk about the medics, they play a so important role on the front line. If our medics infected and they fall down on the front line, I believe that really impacts the morale as well as the confidence. So right now we can see with the development of the better protection, I can tell you that look at the other cities. And we have organized more than 40,000 medics to assist Wuhan, because they protect themselves so well, and they also have that capability to support Wuhan. according to my knowledge, the medics supporting Wuhan are free from infection because they were doing a good job in self-protection. And also I have seen the foreign journalists. So in your country, please help me, I emphasize the nosocomial infectious management. I first went to Wuhan on January 18th and 19th. I have learned that the medics were infected. And the medics actually is not from ICU and not from the respiratory disease, actually from the other departments, from neurology, because the doctors from Department of Neurology actually were not have enough awareness or knowledge about how to protect themselves. And also we heard different news about like the 13 medics actually were affected in other departments. That is why once we found this situation, we emphasize so much on protection. So you look at later on, the medics in Wuhan and also medics to support Wuhan, they were safe. We talk about actually the medics, no matter they support Wuhan or support the other countries, they actually lend a helping hand. And also we have the director Xu Yonghao and also another director from the Department of the Respiratory Disease as well as Respiratory Department of Radiology. Actually, right now we fight in foreign country.
Thank you very much. Andrzej Borowek with the Polish press agency Guangdong. Dr. Zhong, could you tell me why, in your opinion, this virus is so dangerous? Is it only because it's new and we are still not ready for it, or is there anything about the virus itself that makes it so lethal? And partially answered already. For the government, what specific measures do you suggest as the most efficient spread of the virus? Thank you very much.
想问一下，就是关于我来自这个波兰病毒社，那么我想知道的是，您认为这个病毒它为什么有这么大的杀伤力？为什么这么危险？是因为它是一种全新的病毒呢，还是说因为它这种具备一定的特点？那么我的第二个问题呢，您其实刚才也已经大概给予了我们一些答案，就是鉴于我们目前在欧洲所出现的情况，欧洲的这些国家的政府应该采取哪些措施来防止它进一步的扩散？
Thank you very much for the question. All right. To your first question, yes, indeed, this is a brand new virus. But actually gave us a really heavy lesson. In this century, actually, we have encountered 3 coronavirus. Back to 2003, SARS. Second, 2015, MERS or 2012 MERS. And this time, 2019 coronavirus. Of course, different epidemic or virus with different features, but look at the history, how that impact human beings. We actually quite learned the lessons from coronavirus epidemic in this century. We have never ever encountered this in the previous centuries. So this is a new coronavirus, and this is really contagious. We look at these 3 coronavirus. SARS, around the world, the mortality rate or fatality rate is around 10%. MERS is approach to 30%. Look at coronavirus, COVID-19. right now, because the number is so varied around the world, right now the average is around 1 to 2% for mortality rate. But still, this is so contagious. That is why you look at this. We don't know why this virus is so contagious. It can transmit it in so fast speed. We talk about ACE2, that's the enzyme, and plus spike protein. So that can only trigger the lesion to your lung and also infected your immune system and cause your body suffered the inflammatory cytokine. That is the whole process of infection. Of course, there are still a lot of areas for us to have further understanding. Right now, SARS has already finished for 17 years, and we attach great importance to this. But actually, after the several years of SARS, we saw this maybe just a occasional event. We didn't really have the really solid understanding, the treatment process prepared for SARS. Actually, that is why we look at this time with lack of preparation at the very beginning, and that's the lesson we learned. And second, we'll talk about what kind of way we should approach we should adopt it. So you're from Poland. So we talk about that the Polish government has attached great important attention to this, and you attached the attention to, let's say, the traffic, the restrictions, and also the early identifying the patients, and also for quarantine them. These are also very important. We talk about once the patient are confirmed, no matter they with symptoms or without symptoms, please quarantine them. So that is why I call on to all European countries. We talk about not only for the confirmed cases, close contacts, suspect cases, please identify them as early as possible to prevent them spreading the disease to others. Right now, you look at the Dr. Tedros, the Director General of WHO, right now identified that Italy as the epicenter in Europe. Right now, I believe the European countries right now is facing the first round of epidemic with so high intenders. I believe they should take more proactive measures. We talk about patients and the family members, the close contacts should all go for testing and also quarantine them. I believe that by doing so, it can help them to control the spread. Don't wait until it's really hard to deal with. I believe right now, so far, the early identification and the quarantine are the most effective one. Thank you. Thank you very much, journalists from Polish news agency. And also our PowerPoint will be also available to you after the conference. Right now, looking at the number in Poland, the confirmed case is 220 and 13 cured. And also please help us to convey the best wishes to the people in Poland. With CGTN, My question also to Academician Zhong. We know actually you have conducted many rounds of the telecommunication with experts from United States and from Europe. I would like to know that what is the most part you discuss? And for this kind of the remote discussion, that will be normalized and we will involve more countries to join. Thank you so much. Yes. At a very early day, we work with ECRS because they would like me to do a lecture so they can put that on their website. So all the countries can learn from that. Actually, we have so close cooperation with ERS. So our team is not myself, actually my team actually helped to make a presentation with a PowerPoint document with ERS. We shared our experience, our understanding of COVID-19. And we also had a meeting with 5 countries, Japan, Singapore, Italy, Hong Kong ICR. And we also conducted 3 times with Harvard Medical School. And we will have another round of the video and the telephone conference with Harvard Medical School regarding the pathologies. So we will discuss about the pathology and also the pathology of complication with the Harvard Medical School. And China actually accumulated our lessons based on our practice in the previous 2 months. And we would also like to share our experience in this regard. Because for other countries, they had less knowledge in this regard. I believe we would like to share with them our understanding, practice, to inspire them. We talk about a patient in a terminal stage, and we talk about they have much a mucus in their trachea. So they suggest that whether we and talk about actually help them to before they use the fibrosis in the lungs, that really can help us to deal with it. So this is a normal practice in other countries, and they're saying that whether we can also use this way to first to dilute the mucus in the lung and to treat the critical patients. Actually, when the patient developed to a critical stage, the treatment was really challenging. So we talk about during our exchange. So we conducted a lot of technical discussions. Actually, it's also really a good practice for us to really learn from each other. We talk about it's not SARS. SARS actually happened mainly in China, but right now it's different. For COVID-19, you look at it's the confirmed cases, more than 110,000. Right now, China is around 80,000 confirmed cases, right? So it's around the 105,000. My expectations, of course, the number will for sure increase, because for the first round of the spreading, the speed was so fast. Actually, our lesson, our experience helped them to really save more time. And look at the European countries, look at United States, they have already made modification on their national strategies. We hope our lesson, our experience can helpful and inspiring to them. Thank you very much. Thank you, the journalists from CGTN. From Guangzhou TV, my question to Mr. Huang. As we know, the first affiliated hospital of Guangzhou Medical University in the recent to the major public health emergency actually made a great contribution. Would you please show us why that our hospital can make these tremendous efforts? Thank you very much. We talk about the 2003 SARS and COVID-19. Actually, we always bold to make breakthroughs. I believe this is our therapy. Actually, first of all, we have our strong DNA, and also we follow the Nanshan style. That also actually is a good practice in this time, and we always carried forward our spirit and also led by our well-known academicians like Academician Zhong. And for our doctors, new generations born after 1980s, 1990s, actually they volunteered to raise themselves to rush to the front line. That also showcase that the good spirit carried forward, and that's always in the DNA of all the medics of our hospital. And we also focus on the reform. We talk about our company's a complicated public hospital. Actually, we focus on the respiratory disease, the critical care medicine, and we would like to build a top ranking departments. And we also talk about department of the radiologies. We would also like to focus on these departments to give strong support to the key departments. That is why you look at we have these MDT strong teams to deal with the critical patients by providing the very best solution and therapeutic plan to them. And also talk about our hospital, we have a strong foundation in terms of the basic science research as well as respiratory disease research. During this time, we look at our clinical research and the basic science research help us to lay solid foundation to provide a very best solution to treat a patient by providing the most cutting-edge medical supplies. And also we rely on the national level platform. We talk about the nucleic acid test detection capacity that help us to make a early detection, early quarantine. That is the everything about prevention and control measures should rely on the result of NAT. So for us, right, the daily capacity of detection improved from 30 to 300 per day, and the highest number for us is 400 cases per day. That's really a helpful force for us to treat the patient. Thank you very much. Yes, indeed, from the answers provided by the Mr. Huang, that although we are a small hospital, but still we have a strong DNA, always bring the interest of the country in my mind to treat our patients. So we talk about we should always put the treatment of patients at the top priority, make sure the critical ill patient has their personalized therapeutic plan. With NHK Japan, my question to Academician Zhong. Right now, China has fewer patients, but on the other hand, the world right now is witnessing more confirmed cases. How you evaluate the prevention measures taken by Japan and other countries? And we talk about the whistleblowers. That we talk about a well-developed country should not only have one voice. What's your take on that? I first answer the first questions. Yes, indeed. We right now have more imported cases. First of all, China have conducted the most stringent and thorough intervention measures. Started from January 23, we conducted the lockdown of epidemic epicenter Wuhan. Then we reached peak within 2 months, which is within 2 weeks, and then we talk about just within 1 month. From January 23 to March, actually the curve is flattened. So the time is really short. I also believe the measures taken by Japan is feasible. It's also a correct measures. I believe it also should Japan notice that for other countries, they are right now experience the first round of epidemic. So with really high contagious features. So for us, we already experienced this, right? For the first round of patients, they actually can transmit others when actually they didn't have any symptoms shown. So for other countries, especially hard-hit countries, should pay attention to asymptomatic patients. So we talk about the quarantine, very important. Another is NAT. Detection also play a key role. So we actually have different ways like IgM antibody. That's also good for testing. That's also a supplement detection measure. But you make this as a screening, a primary screening method. Still too early to do so, because based on our finding, the imported cases, especially the person from hard-hit region, this group of people actually show no symptoms. But if you look at their NAT, it's a very high percentage of patients actually is positive. If you use IgM, not really show this result, because we talk about IgM actually is once you infected, and then 3, 7 or 8 days later, IgM was produced. So IgM antibody detection is additional screening measures, but you cannot really only rely on IgM. It's way too early, especially for imported cases. So the nucleic acid test is most important. So we talk about nasal or the throat swab are very important, especially the nasal swab test is very important. It's because it's more accurate. We talk about the Japanese people, actually they really focus on the hygiene, so they do a good job in terms of protecting themselves. Of course, you also face these common issues about the imported cases. So we should stay alert to the imported case, because China, with these so stringent intervention measures, so it's dropped dramatically from 80,000 cases. Right now, you look at it to a really single digit. Guangzhou, just within a very short time period, we have 7 imported cases confirmed. And also these cases with very strong contagion, so we still need to stay vigilant to the imported cases, especially the people from the hard-hit countries. Do not look at the symptoms they showed. Do test. To the second question. We will talk more after the press conference. So China and Japan share a long-time friendship. So we talk about it. Fukuoka gave a great support to us and also transferred the masks and other supplies to Guangzhou. And right now we also prepared the supplies to Japan based on our learnings. We for sure that will strengthen our friendship with Japan. And yesterday, the Summer Olympic Tokyo 2020 will still on schedule as planned. That's really good news. Remin Daily. We talk about we should build a community with a shared future, so what we can help the other countries. This is an infectious disease, so we talk about the virus respects no border. It can happen in any country. If any country not take stringent measures to cut off its spread, then we will never win the fight. Of course, different countries have different understandings about the disease, and we should conduct more communication and also to exchange the experience and lessons in different countries. And the practice, especially the interagency prevention and control, was approved feasible. We talk about the early protection, and we also see that the ROK and Japan doing a good job in this regard. It means less public gathering, wearing masks, stay at home. And also, you need to increase the public awareness. I remembered that I got back from Wuhan. The CDC actually gave the power to the entitled hospitals for the nucleic acid testing. I believe this is really helpful for us to early identify the patients, confirmed, suspected, and close contacts. So by doing so, we have contained the spread. And also right now, look at other countries, they also have this kind of practice. So we should reach a agreement in this regard. We'll need to reach a consensus in this regard. If this practice is feasible, it works, it proved effective, then we should go with it. Another thing I would like to see is more cooperation. So at the very beginning, in our most difficult time, as the President Moon Jae-in said that China gave a great support to ROK in fighting MERS. It's a time for us to pay back to China, to help China to fight COVID-19. We actually experienced this most challenging situation. So when other countries face the same situations, it's our responsibility, and we're also willing to help them to deal with it. Actually, it's so hard within a short time period to produce like the hundreds of thousands of masks. And also another thing is the kits, the testing kits. Actually, China right now, we have that a productive capacity to do so. So we talk about actually is cannot really rely on one single country to fight the COVID-19. As long as there is one country suffering this infection, then no other country can immune from it. So we talk about the different countries have a different progress in the different sectors. But we look at the actually vaccine research and development. We can all share the results. And same for detection. Same for research on transmission route, the prognosis, the mechanism of transmission, and the patient treatment. I believe as long as we work together, we will for sure to win the fight. We work towards the same goal that we should focus more on the upstream and share the results of research. Thank you. So right now this is an epidemic. No country is safe. And we talk about the more than 100 countries and international institutions actually give us great support. And we talk about the ROK, Japan. The premier of the Hun Sen actually paid a visit to China, and they also have a different donations or support given by Mongolia. And China also are ready and willing to share with our experience. And we also had the communication with experts from the ASEAN, from European countries, the United States. So we for sure to tell everyone around the world, you do not need to reinvent the venue. So we actually, as you mentioned, with CNR, we talk about that China actually had taken the very effective measures like the 4 early and also the patient treatment as well as 4 concentrations. Actually, all these has proved feasible and effective based on our actual practice. Do you think all these measures are also good to apply to other countries? In principle, yes. Based on my observation, the European countries actually also have this kind of the practice, and you look at the Lombard actually is lockdown. But we talk about it actually still going out for coffee, meetings. It doesn't work. It's not really literally a lockdown. We mentioned about the 4 early practice. The nucleic acid test, only CDC would approve to do so. That's also the case at a very early date in China. But actually look at with the training, actually all hospitals were capable to do so. So we very soon to identify the patients. So the majority of the patients actually were locked in the hospitals. So we believe that this is the thing we should do, that hospitals to do the nuclear test. Actually, I can tell you we made a really strong and decisive measures. This is a really big decision made. We talk about General Secretary Xi Jinping emphasized so many times that we should always put the health and safety of people at the top priority, which means, in other ways, saying that maybe we may pay a really costly price, but we should save people's life at whatever price. Indeed, actually, I can tell you in the past 2 months, we really paid a heavy bill because our economic developments, I can tell you, actually slowed down. But we saved the majority of people's life. We really devoted a lot. We really sacrificed a lot. But when you look at actually majority of people are safe, or people actually were cured, discharged, this is the most pleasant thing to see. I believe this is something the other countries, their government, should think about. Of course, we're not saying that a Chinese practice is the only way. We talk about our key focus. We worked toward the same goal, which is protect people, make our people safe. So that's really hindered the economy. And right now, when we look at the current stage, we mentioned about resumption of work and the production. So we need to do a good job in coordinating the disease prevention and control with the resumption of work and production. That is because right now China facing a rising number in imported cases. So we emphasize on both fronts. But look at other countries. You need to focus on one thing when you're facing a severe condition. So this is what choice China made. Look at the past 2 months. I did a little calculation. We posed that idea that we should lock down the epicenter, especially Wuhan. And also we practiced a joint disease prevention and control. From January 23 to March 3rd, you look at actually the curve peaked on 4th and then it started to decrease. Just within 1 month, we reached the peak and back to the level before the epidemic. Because look at China, the majority of the cases happened within Hubei province. We look at the national strategy. We have successfully contained the wider spread. If we had not taken that measure, the whole situation could have been really challenged. We talk about the Leishanshan Hospital, construction of Leishanshan Hospital, Huoshenshan Hospital. Actually, that's really provided a valuable bed for the patients to be treated. Actually, the role of all these hospitals is actually we would like to bring all the confirmed cases, the suspected cases, to separate from the healthy people. Don't let them to stay with the healthy people to spread others, to infect others. So this is the purpose of building the hospitals. So I believe this is really good practice in terms of for early practice, for concentration, and other effects. It's China Daily. My question regarding the Guangzhou Institute of Respiratory Health. Regarding the cooperation and the synergy created with other players, no matter it's from the universities or the other institutes or companies. Work closely with the other institutes like the Chinese Academy of Science, because we have a lot of co-projects going on, and we also actually had a different research like AI. We work with different universities in AI sector, and because our projects involve many different sectors, so we work with different universities and the companies. Modeling. So this is also one of our projects related to COVID-19, and also work on the antibody research. And also our results will be available and shared with other players.
那么就是我想问一下钟院士，那刚才呢这个问题我也已经提到了，就是说他有什么样的经验是可以。第二个问题就是说，当我们处理重症的病人，有没有什么好的经验？谢谢。
Direction for the better. And you look at actually all countries right now take a quite stringent intervention methods. And of course, I emphasized that we should focus more on upstream. And to your second question about do we have the most effective method to this virus? There's no the most effective method to this virus. We have some very good practice based on our 2 months practice and also our experience in MERS and SARS. We use some the medicines that we use to treat SARS or MERS, and we also use the chloroquine phosphate. That's the anti-malaria medicine. We actually have tried different ways because the most urgent task for us is we want to save people's life. And we tried different possible candidates. Another one is remdesivir. That's a medicine under investigation in the United States. Right now, our Professor Cao Bin in Wuhan is also doing a research and a practice, and we will very soon hear the results. Another, we talk about TCM. Actually, TCM really helped the patient to improve their symptoms. Especially, we found that at the circular level, it showed some good inhibitory effects, and we will sum up the practice from the clinical trial. So far, there is no the most effective drug, but anything that can help to improve the symptoms and to foster the cure period, then we would like to try. Thank you, the journalist from Serbia. And we also would like to thank you, the people in Serbia, for your great support to China, and also the best wishes to all the people in Serbia. We talk about the imported case to Guangzhou. Just within a really short time period, we found 7 confirmed cases from different countries to Guangzhou. So for this virus, it's different from SARS. Has really contagious. So before the patient showed symptoms, it's already can transmit the virus to others. So that is why I emphasize that we should have a really good job on screening. So for Guangzhou right now, we right now facing quite a prominent situation. I believe other cities also have quite daunting task. In this regard, we talk about the airplanes, trains, or ferry. We should all conduct the screening on the passengers. We talk about IgM, IgG antibody detection, but still it's too early to apply. Before actually, I believe because this is so early, we actually can really fast get the results. But we look at the hard-hit country, if the patient or the people from that country actually there was a really strong positive result from NAT, but they show no sign in IgG or IgM antibody test. So it's really early to apply the IgM antibody test because other countries right now still in their first round. So for the imported cases, we need to strengthen our efforts on the immigration control. So we also have designated hospitals for the imported patients, and we also have a quarantine hospitals for suspected cases or the close contacts. Still, some countries still at their early date. That is why I emphasize on to use the nucleic acid test to identify the confirmed cases. So I believe actually, like say in Wuhan, maybe also the same case in other areas, the hospitals actually in the past 2 months, the whole resources actually focus on the COVID-19 patients. But look at other non-COVID-19 patients, like the patients with tumor or other chronic disease. So for right now, we emphasize on the epidemic prevention and control and resumption of work and production. For Wuhan, right now, they focus on the disease prevention and control as well as bring a normal hospital service back. So we talk about a patient that should receive treatment, but because of received the treatment in a timely manner, then they may die. So right now we look at the outpatient number in 160 hospitals. The number surpassed 60%. Because right now we practice the booking practice. So you need to go to the hospital, you need to book an appointment first. We do not want the hospital become a new infection area. So like the case happened previously in Wuhan. And also we talk about we have the two passageway, one for the doctors, nurses, the other passage for patients, and all the patients, if they need to be admitted or discharged, they also need to test for COVID-19. So we talk about we first should focus on the control of imported cases. Another thing is we should bring the normal medical service back. So I also call on our friends from the media. So this is a big impact to our economy. We should bring everything back to the normal order. So in terms of the humanistic care, we have also conducted the screening of the imported or the inbound passengers, and we will also conduct the different ways to protect the legitimate rights and the interests of the passengers. And for more discussions on this topic, we will have another press conference tomorrow morning. Thank you very much, the journalist from Guangdong TV. I would like to give this question to Mr. Li Min regarding the role played by party members. Since the outbreak of the epidemic, we have earnestly implemented the key instructions and deployment made by General Secretary Xi Jinping. All the party members have also conscientiously practiced the Nanshan style and shoulder the responsibilities, and the party members stay to their position on the front line, and also have conducted scientific-based and targeted measures to treat the patients. And we focus everything on the disease prevention and control, as well as the medical rescue. And our party members also dedicated to the endeavor of the disease prevention and control, and they have always stay true to their aspiration and always remember their mission, shoulder the responsibilities. We established a temporary party committee at the Frontline in Wuhan. And the chief of the Frontline team of Guangzhou, actually our president, and also the director of the CCM. Once we arrived in Wuhan, we taken the responsibility of treating the critical ill patients. So we have taken over the one ICU ward and admitted the patients upon our arrival, and we have conducted the around-the-clock treatment. And we have conducted our work in the Wuhan Union Hospital. And we have the two new members join the party in Wuhan. So the team supported the Union Hospital. Actually, is also have the party members all covered. And also, actually, we have this heraldic team. They had a rich experience in fighting SARS. And also, we look at the party members. Actually, they volunteered themselves to rush to the front line. And we also have the different party branches involved in this endeavor, and also the headquarters in Wuhan to do everything to make a good preparation, make sure that the what is needed and the front line, we have the support from the backup. The Sangli, the young generation in the critical care medicine, is the first party member to support the work in Jintan Hospital in Wuhan. Dr. Xu Yonghao. Actually, the next batch of assisting Tibet. On January 25th, which was the very first day of a Lunar New Year, and he took the early morning flight back to Guangzhou, joined the epidemic fight. And on the February 7th, appointed by the Red Cross Association, joined the work to support other countries, and he also delivered the commitment when making the oath to join the party. So where I was needed, you will always find my presence, and this is our job to save the people and devoted ourselves for the boundless love. So look at our party members. They have risen to the challenges, delivered their commitment, and also shoulder their responsibilities to treat the patients. Started from January 17th, 33 days and nights. The party flag always fly high over the battlefield. And the party branch also actually has unified the whole party members, and also create the synergy and make the people energetic. And we also have the 4 new members joined the party. And also the academic Zhong also witnessed their oaths to the party member, to the parties. And also we have mobilized all the party members to devote themselves to make the actual contribution and to build the front line, the fortress to protect our people. Thank you. Yesterday on March 17, the 3,787 medics from 19 provinces actually were departed from Hubei and Wuhan. I believe that we will very soon to see our medics back home and start their normal practice at their home headquarters. I have a question to Mr. Zhao. So the National Clinical Research Center for Respiratory Disease is the only respiratory disease research center in China. So what's the role and projects we have? For the national key laboratory, actually, is to focus on the basic science research and application. We talk about no matter what the disease is, right now this time is COVID-19, actually science and technologies should be the most powerful weapon to kill the enemy. So since the outbreak of the epidemic, our laboratory have attached a great importance on how to better leverage the strengths of science and technologies to fight the epidemic. Academic Shenzhen always give us great support and guidance, and we should better coordinate and integrate the clinical practice and basic science research, and also commercialize our research results. Actually, we already introduced the early results, especially the detection agent and also the detection kits already approved by the national FDA through the green channel. And we also not only have seen some progress happened in the basic science research, and we also received a good feedback on the clinical practice as well as the involvement of AI that help us to focus on the development of the epidemic. Right now, I believe the accuracy is really high. And we also have some products regarding the nosocomial infectious management so that we'll better protect our doctors and nurses when treating patients. Regarding the pathology and the epidemiology, we have successfully separated the strain of a virus from the feces and the urine of the patients. So it's really meaningful for us to do the research and also lay a solid foundation for our later on research. And we also established the non-transgenosis animal modeling. All of these actually should give the credit to our previous work made in the science and technology. And going forward, we will focus on the three areas. First is also the vaccine that's really draw everyone's attention. So we will also need to verify the in vivo experience. We talk about the TCM, the antibody drugs, and also should be verified and also evaluate is the efficacy on the animals, and also laid a reference or the foundation for us to treat patients. And the third part is also the most important area that need a long time accumulation and endeavor. That's also the focus on COVID-19 pathology. We talk about actually SARS didn't do a good job in this regard because we stopped the research. So we talk about not only for the COVID-19, we talk about that we should better understand the pathogenic mechanism is for COVID-19 or for COVID-19-like disease. We think about the pathology, we talk about pathogen, we also think about the host, no matter it's human being or animals. We talk about the etiology, we look at what kind of the cytokine or what is the factors that really cause the symptoms to develop in a really critical stage. And we talk about the host. We look at the bodily immune system and how that related to a severe or the critical symptoms, and how we can strengthen our immune system, make sure we block the way to severe or critical condition, and or what kind of things we can do to improve our immune system so that patients still can survive in a critical condition. I also talk about the COPD, we talk about the diabetes or the other underlying disease. Actually look at the whole population. We have a large proportion of population actually with underlying disease, and also look at our patients of COVID-19, also the majority of them with underlying disease. So we look at the different kind of underlying disease and how that related to COVID-19. That will help us to improve the cure rate and also help us to prevent these group of patients developed to severe condition. Thank you. Thank you very much, Zhao Jinchun. So this is trusted by the Guangdong Medical University, and this is also only one national key laboratory focusing on respiratory disease. Academician Zhong Nanshan is the first director, and right now is the Professor Ran Bixin is the current incumbent director of these national level key laboratories to make more contribution to the country. Thank you. Let's move on. Guangzhou Daily. My question goes to Mr. Zhong. We'll talk about right now one of our key priority is the development of a vaccine and drugs. Would you please talk more regarding the variants? And we talk about right now we should share more with other countries regarding the drugs and variants. So how can we better cooperate with others to develop the vaccine? I believe vaccine really is in everyone's interests. The vaccine, I believe, holds the key to treat the patient. We talk about the children when after they're born, they need to got vaccines to treat the different disease like the pertussis. And we talk about the mortality rate of polio is really high. It's around 25%. We talk about smallpox. Also quite prevailing before, and actually vaccine solve the spread of smallpox. And once you injected the vaccine, you will free from smallpox. So right now, China focus on the 5 different vaccines. We talk about the swine flu as H1N1 swine. So around 90 million people got the vaccine. The second one, mRNA vaccine. Look at the document on March 16. Right now, United States applied this vaccine to human body to test the safety. China also developed very fast in this regard. And we talk about the tests on animals regarding the safety and efficacy, as well as the pharmacology all passed. Very soon that will be applied to human being. Another vaccine, that's the adenovirus vector vaccine. We also look at the genetic engineering subunit vaccine, and also the vaccine using attenuated influenza vaccine as vectors. So total 5 vaccines were developed, and we actually quite keep at the same speed as the United States. And this time, the General Secretary Xi Jinping also paid a visit to the institutions of science and technology working on vaccine. We talk about the kind of acute infectious disease. In the end, the vaccine will help us. That will save all of us life. So I believe that the United States in September, they will start to use vaccine on human beings. I believe China is also keeping up its speed in this regard. And we also have conducting communication with other countries. mRNA is one of our key focus in Guangdong Province. It's also the United States is going to do so in this regard. And right now we're doing the counteracting toxic substance tests, and another is adenovirus vaccines. So no matter which country develops successfully, of course, they cannot really supply the vaccine to the whole world, because we need to learn from each other to leverage the strengths of different countries, different vaccines. We need multiple manufacturers to produce the vaccines to fulfill the needs of the more than the billions of people. So regarding mRNA vaccine as well as the adenovirus vaccine are our two key focus right now. We're working around the clock to deliver, hopefully, a big progress in 2 months period. So we work with all the countries fighting on the front line of fighting against COVID-19. Hope that we can have the available vaccines as early as possible. And Hong Kong Business Daily. My question also goes to Academician Zhong. WHO announced it's a pandemic. As you mentioned, this really contagious disease. And you also have been conducting a continuous research in this regard. Would you please share more about the understanding of the virus? Thank you very much. Journalist from the Greater Bay Area. I just mentioned that we look at the R0 ratio reproduction knot. So which means like one person, how many person that the infected patient can transmit it. So right now the R0 ratio is around 3, which means one confirmed patient can transmit the virus to 3 people. So 2 things bring to our consideration. First, the infection is actually a document released by the CDC. We look at the upper respiratory tract. That's what we found from the nasal or throat swab. So the onset of the infections, the contagious was really strong, and that contagious start to decrease after 1 week of infections. So this is so different from SARS. So if we talk about SARS, it's not that strong in terms of transmission in the incubation period. We talk about the virus carrier of COVID-19, although in incubation period, they were actually strong in containment. So we talk about the infected patient. We ask about whether you explore to the people with the travel history to Wuhan. Yes. We talk about you have the contact with people from Wuhan or with the travel history to Wuhan. We found that the people actually have a high possibility to be infected. That's based on the research, and also we had a meeting in Germany. That one person had a meeting there, and back to China, that person found confirmed. And his colleague didn't travel to Germany but are also affected. So we talk about the transmission feature. We talk about that the virus carrier before the symptoms shown was really strong in transmission. So that is why I emphasize that for the patients and showing the symptoms, please test the close contacts and also identify this group of people as early as possible so you can really screen the people with higher possibility of infections and quarantine as early as possible, and then you can lower or minimize the number of infections. This is my understanding about this disease. As we know, the countries actually has worked together to help each other to fight against COVID-19. And also we talk about our practice, and if, of course, we also would like to share with others, especially the practice proved effective. Of course, we didn't see that all the countries should follow the Chinese way. They should also to do by the best approach fits in their condition. But I hope the Chinese approach can be a good reference to them. Nanfang Daily, and we found that we have seen a really good young generation of doctors. They play a key role this time in the disease prevention and control, especially the medics born after 1990s and 2000. We talk about on January 23rd, the country announced the lockdown approach, and we had a doctor went to Wuhan and worked in Jintan Hospital. He with really outstanding performance, and he shared with others about how to treat critical ill patients. It's a really young man, and under is Xu Yonghao. Regarding ECMO, that person has rich experience in this regard. So we call him back from Tibet, and he actually saved a lot of people's life by applying ECMO. And the Red Cross Association would like us to send medics to Iraq. So we talk about, so it's really hard for us to go to Iraq. So because the Chinese captains didn't really familiar with the flying routes, because we know that should be really careful still in a real war time, the war situation. So we invited the pilots from Iraq to help us to bring the doctors and nurses to their country. So we talk about medics. Their image actually changed a lot in people's minds, and we talk about the safe day. So people really think that the evils in white. But right now, look at with the angels in white. So maybe this will change later on. We talk about, for my understanding, we have never changed. For our medics, they always the angel in white. So single case cannot represent the majority of the medics. It's not really my understanding on the new generations. Actually, I would like really to say about the whole image of our medics. We talk about the non-COVID-19 patients maybe have some complaints because they before didn't have that access to get medical services. So that I don't really think medics, they were angels because you really need them, like when we face this kind of epidemic or the earthquake disaster. Because medics, they really put their life in danger to save our people. So I really like to say this to all journalists. Our medics in China, they always the angel in white, and they really dedicated and devoted themselves to this job. We talk about our angel in white. That should be the name for our medics. And also should be never changed. And on March 15th, General Secretary Xi Jinping actually wrote a letter back to the young generations of doctors and nurses working on the front lines, the people's. The Peking University said that the young generations working along with the other medics to really showcase the energies of your age, and also you give a satisfactory answer to this task, and you also showcase that you can shoulder the responsibilities in the new era. And Academician Zhong also mentioned two people, Mr. Sang Li, the associate chief physician, and another right now in Iraq, born after 1980s. Xu Yonghao, actually, he worked in ICU voluntarily when fighting against SARS, and this time he also voluntarily performed his job on the front line, and also right now in Iraq to help the medical treatment going on there. And we had a side news that the Dr. Wang died in line of duty, Mr. Wang Shuo. We believe that we should not ever let our medics down because they shoulder the responsibilities. They never let us down, and we should really consider and put ourselves in their shoes to really help them solve their issues or their difficulties in a timely manner. Thank you very much. My question regarding TCM is well welcomed and endorsed by the Chinese people, and also look at the international communities paying a growing attention on the role of TCM. How you evaluate the role of TCM play at this time in treating COVID-19 patient? As a physician, we believe that TCM play a key role this time.
好，我们请工作人员在台下的我们杨楚峰教授，我们请工作人员在左前方这位。他是专门负责中医药。I will like Mr. Yang Zufeng to help me because he is in charge of the work related with TCM.
要的抗新冠的工作。何院长已经介绍了，在我们基础当中呢，上一次的发布当中我们讲过，我们在紧急到了更多的药物，并且还有找到了单体。
So as the previous introduction, actually based on our previous research, and especially the basic science research, as well as the research going on in the Research Center for Respiratory Disease. Actually, we had the experience rich in this regard, and we also made some progress in the clinical practice. And we also sum up the progress.
实际上，这个工作呢，我们这个我要phytomedicine 还有 pharmacology research 这个重要的特刊的组织，实际上现在国际上非常关注中医药，而我们这个单位。
The international community right now has been attaching great importance on the role of TCM, so we also would like to do more to tell the story of the TCM, and we also actually use the 莲花清根 capsule. This time the medicine TCM actually also going to the other countries to help our work in other countries, and also received the approval by the other countries' FDA. I believe the role of TCM should be known by other countries, and let the TCM play a bigger role. So for today's press conference, actually we received great support given by academician Zhong and also the leadership from the Guangdong Medical University. Thank you very much. CMG CCTV, I have another question as frequently asked. Regarding the source of COVID-19, so what's your take on that? I believe maybe the source of virus may not directly related to the infection. We talk about the other disease may happen in Mexican. Can you talk about its Mexican virus, and also same apply to MERS?
所以这个它是一个自然形成的一个，我这个认为啊，新冠肺炎的疫情。
My understanding is, indeed, COVID-19 epidemic first happened in Wuhan, but it's by no means that the virus should be a Wuhan virus. So we should really respect science. Right now we have people working on the understanding of the source of coronavirus. Right now we look at it, actually within this family there are 7 members. We actually can't understand. But right now we don't have a clear answer. So before that, you cannot really say a simple answer. That's not reasonable and not responsible. For myself, I don't know where the virus started. The epidemic started in China, but I don't know the virus was also started from China. We talk about actually right now it's China in terms of the scientific research. We actually have made a lot of progress. We will for sure have a clear answer in this regard. Thank you.
是在外交部的记者会上，针对某国总统近日在社交媒体公开把新冠肺炎称为中国。
The spokesperson of the Ministry
世界
of
卫生组织和国际社会明确反
Financial Affairs also the answers regarding
我
the
也
a
想
certain
就刚才这边
country's president called it a Wuhan virus.
世界经济
And
论
the
坛上
WHO
我想有可能会和广州有可能会
also had a clear statement in this regard.
而是无知、迷信和偏见，把保护主义如同把自己变黑屋子。空气，小智治世，大智治治。大道
So we talk about this should not be a
中国人民
stigma.
深知实现
This only showcase the ignorance
在，都为他们祝福，都希望他们的日子越过越好，不会犯红眼病，不会抱
and
怨
prejudice.
中国发展得到了。
We talk about that we should fully respect the achievements made by China, and we should also wish the Chinese people in a healthy life.
应
And
该是许正颂叹，而不应该是说一些落井
we should not be jealous about the progress made by China, that we should build a community of shared future. We live in one globalized village, and we should work together and to fight against the same enemy. Due to the interest of time, I believe will be the one last question.
谢谢主持人，我是来自中新社的记者，有个问题想问一下钟院士，当地的话，对于我们抵御这个新冠
China News Service.
健康呢，有什么
My question regarding the immune system.
中心的话题啊，我们请钟院士回应一下，就是关于健康。
How we can better strengthen ourselves in terms of how we can build up a healthier body or immune system. So this is really the question you like to ask myself, my personal experience, or this is more for the a public education?
健康是一个人干事情的本钱，健康是需要投资的。
I believe you should invest in your health. And also, if you are healthy, that will be the premise of doing everything. So think about I'm healthy, I don't have any disease. Yes, really have a normal life, I work. Actually, for myself, I really realized this. I really like doing sports. I really noticed that we should invest in health, which means we should have a really healthy life routine, the healthy habit. I still can make contribution this time. I believe first of all should be attributed to my healthy body, mentally and physically.
因为我们你们搞媒体或者我们搞医疗。
So for the journalists or the medics, we work really hard and really busy, but you always need to think about find the time to do some exercise, to work out. And also I talk about the psychological condition. So we talk about health. The whole concept should include two parts, mentally and physically. So for myself, I experienced all different kinds of the ups and downs, experienced so many things because of my age. So we talk about the mentality or mindset. So we talk about the stay positive.
钟南山背后的理念。 三个重要的是什么？不要太这个是早要说的这个意思，是这么个意思。所以到现在来，就是还是能够。习主席说的，没有全民的健康就没有全民的小康，所以这一条，我想各个都是。
So we talk about this year, we need to build a moderately prosperity society in all respects that should really rely on a healthy condition of our people. Thank you.
非常感谢我们媒体朋友的提问，这个问题可以说中院长地域是个科普的，还是说是一个作为专。第三个是早上不要吃太饱，早餐很重要。
So we talk about actually breakfast is very important, but we do not need to really eat a so big breakfast. So the General Secretary, Academy Shenzhong also emphasized the importance of breakfast as well as stay positive and be happy. And also we talk about the mental health also very important. We talk about Academy Shenzhong, hero in harm's way, and you also look at this is a
2020年1月18号广州南站
train ticket.
开往武汉站的。
So I don't know whether our netizens remember there's a photo, a picture actually, reposted by many netizens on the social media platform that the Academy Shenzhong actually slept during his journey to Wuhan. So we talk about that the Academy Shenzhong actually work really under stretch, work under a big pressure, really tight schedule. So this ticket actually really help us to remember the hard work made by Academy Shenzhong. We today answered 19 questions, and Academy Shenzhong answered 15 out of 19 questions. We all know Academy Shenzhong is really a low-key person. He really not really like us to talk more about his story, but I really like to utilize this opportunity to appreciate the efforts made by Academy Shenzhong as well as other medics. And we talk about a little surprise. So the journalists saying that they would like to really express our gratitude to Academy Shenzhong and the other medics. So the presenter, the girl, Grandpa Zhong, my name is Cao Xinwen. So these are the 9 suggestions you give to the public regarding the prevention and control. And this is my small gift. I made it. Wish you good health.
这是我们年轻的小朋友曹新文，他这个画的名字啊，就是
曹新文。
钟爷爷的9大建议，拒绝扎
So
堆，
this is a small
健
painting
康
work
化，减少
suggested by General Secretary Academy Shenzhong regarding the 9 measures to protect yourself, including the no public gathering, wearing mask, wash your hands. So this is a small gift to Academy Shenzhong. Thank you so much. And that's for today's press conference. Thank you all.